baking soda shorten my lifespan? First of all, don't forget to like, subscribe, and hit the notification bell so you won't miss any of our new content. Hello everyone. Welcome to our channel, where we unravel the mysteries of home remedies and explore the science behind them. Today, we have a super interesting topic, baking soda. Yes, that magical white powder you probably have in your kitchen, ready to save you from heartburn or clean even the toughest stains. But did you know that this pantry hero has a dark side that might be going unnoticed? In today's video, we're diving into the best-kept secrets of baking soda. Is it really safe to consume daily? What happens when you overdo it with this common powder? From gastrointestinal issues to potential dangerous interactions with your medications, we'll explore everything you need to know to use baking soda safely and effectively. Have you ever wondered why you feel weird after taking baking soda for heartburn? Or why your blood pressure seems to have a mind of its own after a dose? Get ready to uncover hidden risks and how to avoid them. Plus, we have expert tips so you can continue enjoying the benefits of baking soda without compromising your health. So, if you've ever thought of drinking baking soda like Grandma's magic potion, stop right there and hit play on this video. Let's debunk baking soda myths and learn to use it wisely. Don't go anywhere. Stick around till the end to uncover the whole truth about this versatile ingredient and discover how to make the most of it without any unpleasant surprises. Let's get started. The consumption of baking soda can cause various gastrointestinal problems if ingested in inappropriate amounts. One of the most common manifestations of these issues is nausea. When baking soda is ingested, especially in large quantities, it can irritate the stomach lining, leading to persistent discomfort that may be accompanied by vomiting. This reaction results from gas formation in the stomach when baking soda reacts with gastric acids. The rapid release of carbon dioxide can induce these uncomfortable symptoms. Another gastrointestinal issue associated with baking soda consumption is diarrhea. This condition can occur because baking soda acts as an osmotic laxative in the digestive tract. This means it draws water into the intestines, leading to loose and frequent bowel movements. Diarrhea is not only uncomfortable, but can also lead to dehydration and electrolyte imbalance, which can have serious health consequences if not managed properly. Abdominal pain is another significant gastrointestinal consequence of baking soda consumption. This pain can range from mild discomfort to severe cramps. Abdominal pain may be caused by gas accumulation in the stomach and intestines due to the chemical reaction between baking soda and stomach acid. Additionally, baking soda can alter the natural pH of the stomach, interfering with digestion and causing feelings of bloating and discomfort. While baking soda is commonly used to relieve occasional heartburn, excessive or improper consumption can lead to a range of gastrointestinal problems, including nausea, vomiting, diarrhea, and abdominal pain. It is crucial to use this remedy cautiously and under the guidance of a healthcare professional to avoid these adverse effects. Excessive consumption of baking soda can lead to electrolyte imbalance, a condition where levels of minerals and salts in the body, such as sodium, potassium, and bicarbonate, become disrupted. This imbalance can have serious health implications. One of the most common effects of excessive baking soda consumption is hyponatremia, a condition characterized by abnormally high levels of sodium in the blood. Baking soda is a salt, and excessive intake can lead to sodium accumulation in the body. Hyponatremia can cause a range of concerning symptoms, including extreme thirst, confusion, muscle spasms, and in severe cases, seizures and coma. Hyponatremia can also damage brain cells due to cellular dehydration, which can have lasting neurological effects. Another related issue is metabolic alkalosis, a condition where the blood pH becomes excessively alkaline. Baking soda, when ingested in large quantities, can neutralize stomach acid and elevate blood pH, leading to alkalosis. Symptoms of metabolic alkalosis may include muscle weakness, cramps, spasms, and irregular heartbeats. In severe cases, alkalosis can affect respiratory function and tissue oxygenation, which can be potentially life-threatening. Electrolyte imbalance caused by baking soda can also affect potassium balance in the body. Hypokalemia, or low potassium levels, may occur as the body attempts to compensate for alkalosis. Potassium is essential for muscle and nerve function, and deficiency can result in weakness, fatigue, muscle cramps, and serious heart problems such as arrhythmias. In summary, improper use of baking soda can lead to serious electrolyte imbalances, including hyponatremia and metabolic alkalosis. These imbalances can have severe and potentially dangerous health effects, impacting multiple systems of the body. It is crucial to use baking soda cautiously and under the supervision of a healthcare professional to avoid these risks. Excessive consumption of baking soda can have a significant negative impact on kidney function. The kidneys are responsible for filtering blood and removing waste products and excess fluids from the body, maintaining a proper balance of electrolytes. However, improper use of baking soda can overload these vital organs, leading to damage and deterioration of their function. One of the most evident risks is the development of metabolic alkalosis, a condition where the blood pH becomes excessively alkaline due to bicarbonate accumulation in the body. Metabolic alkalosis can disrupt electrolyte balance, especially potassium and calcium, which can adversely affect kidney function. The kidneys work hard to correct these imbalances, and continued stress can lead to their exhaustion and eventual damage. Additionally, alkalosis can reduce the kidney's ability to excrete calcium, which may lead to kidney stone formation. Hyponatremia, or elevated sodium levels in the blood, is another risk associated with excessive baking soda consumption. This condition can increase osmotic pressure in the kidneys, leading to greater water retention and consequently fluid overload in the renal system. This overload can damage the glomeruli, the filtration structures in the kidneys, and eventually lead to a reduction in glomerular filtration rate, GFR, a key indicator of kidney function. Individuals with pre-existing kidney disease are especially vulnerable to these adverse effects. Damaged kidneys already have reduced capacity to handle electrolyte imbalances and waste excretion. In such individuals, baking soda consumption can exacerbate kidney failure, accelerating progression to end-stage renal disease, which may require dialysis or kidney transplantation. Moreover, baking soda can interact with certain medications that are processed through the kidneys. For example, ACE inhibitors, angiotensin-converting enzyme inhibitors, and diuretics, commonly used to treat hypertension and heart failure, may have their effects altered by changes in sodium and potassium balance caused by baking soda. This interaction can not only decrease the effectiveness of medications, but also increase the risk of adverse side effects. Excessive use of baking soda can jeopardize kidney health by inducing metabolic alkalosis and hyponatremia, overburdening the kidneys and potentially causing kidney damage, especially in people with pre-existing kidney conditions. It is crucial that any use of baking soda as a supplement or treatment be supervised by a healthcare professional to prevent serious complications and preserve kidney function. Baking soda can interact with various medications, altering their effectiveness and increasing the risk of side effects. This interaction is primarily due to baking soda's ability to modify the pH of the stomach and body, which can affect the absorption and metabolism of certain drugs. One of the most common interactions is with antibiotics, especially those in the tetracycline class like doxycycline and tetracycline itself. Baking soda can reduce stomach acidity, which may decrease the solubility and therefore the absorption of these antibiotics in the gastrointestinal tract. This can lead to a reduced concentration of the medication in the blood, decreasing its effectiveness in treating bacterial infections. As a result, the antibiotic's ability to combat the infection may be compromised, prolonging the duration of illness and increasing the risk of developing bacterial resistance. Another significant interaction occurs with antifungal medications, such as ketoconazole. This medication requires an acidic environment in the stomach for proper absorption. The use of baking soda can increase the stomach pH, thereby reducing the absorption of ketoconazole and diminishing its effectiveness in treating fungal infections. This can result in ineffective treatment and the need for higher doses or alternative therapies. Additionally, baking soda can interact with medications that affect electrolyte balance and kidney function, such as diuretics and ACE inhibitors, angiotensin-converting enzyme inhibitors. Diuretics used to treat hypertension and heart failure can cause a decrease in potassium levels. Baking soda can exacerbate this potassium loss, leading to hypokalemia, a condition that can cause muscle weakness, cramps, and cardiac arrhythmias. Similarly, ACE inhibitors can increase blood potassium levels. Concurrent use of baking soda may complicate potassium level regulation, increasing the risk of hyperkalemia, high potassium levels, which can also cause arrhythmias and other cardiac issues. Finally, baking soda can affect the absorption of certain medications that are metabolized in an acidic environment. For example, some antidepressants and nonsteroidal anti-inflammatory drugs, NSAIDs, may have their absorption altered by changes in stomach pH. This can result in decreased medication effectiveness or increased side effects. In summary, baking soda can interact with various medications, altering their absorption and effectiveness, and increasing the risk of adverse side effects. It is crucial for individuals taking medications regularly to consult a healthcare professional before using baking soda as a supplement or treatment to avoid these interactions and ensure safe and effective management of their medical conditions. Baking soda consumption can contribute to increased blood pressure due to its high sodium content. Sodium is an essential mineral for various bodily functions, but excess sodium can have significant adverse effects, especially on the cardiovascular system. Baking soda, as its name suggests, is a sodium salt. When consumed excessively, it can elevate sodium levels in the body, which in turn can lead to fluid retention. This fluid retention increases blood volume, raising blood pressure. Hypertension or high blood pressure is a known risk factor for various cardiovascular diseases, including heart attacks, strokes, and heart failure. Hypertension induced by baking soda consumption is particularly concerning for individuals predisposed to high blood pressure or those with pre-existing conditions such as chronic hypertension. In these individuals, even a small increase in sodium intake can cause a significant rise in blood pressure. Additionally, chronic hypertension can damage arteries and the heart over time, increasing the risk of serious complications. Another important aspect is that many people are unaware of the sodium content in baking soda and use it indiscriminately to relieve heartburn or as a dietary supplement. This lack of awareness can lead to excessive consumption without realizing the potential health risks to cardiovascular health. Furthermore, combining baking soda with other sodium-rich foods and beverages can exacerbate the problem, accumulating dangerously high sodium levels in the body. It is crucial for individuals, especially those with hypertension or at risk of cardiovascular diseases, to be aware of the sodium content in baking soda and use it in moderation. Consulting a healthcare professional before regularly using baking soda is a prudent step to avoid potential complications related to blood pressure. In summary, while baking soda can be helpful for treating certain conditions, excessive consumption can lead to increased blood pressure due to its sodium content. This risk is especially relevant for individuals predisposed to hypertension or cardiovascular diseases. Therefore, it is crucial to use baking soda cautiously and under medical supervision to avoid health problems associated with hypertension. And there you have it, friends, the fascinating and sometimes perilous world of baking soda. We've journeyed through a path filled with crucial information about this popular home remedy, and now you know much more about its potential risks. Let's briefly recap the key points. Firstly, we discussed how baking soda can cause gastrointestinal problems such as nausea, vomiting, diarrhea, and abdominal pain. While it can be helpful for occasional heartburn relief, excessive consumption can irritate your digestive system in unpleasant ways. Next, we explored how baking soda can lead to electrolyte imbalances, causing serious conditions like hyponatremia and metabolic alkalosis. These imbalances can severely affect your body's function, especially your nervous and muscular systems. Thirdly, we discussed the impact of baking soda on blood pressure. Its high sodium content can raise blood pressure, posing risks to individuals with hypertension or cardiovascular diseases. Additionally, we saw how excessive use of baking soda can affect the kidneys. From overloading these vital organs to exacerbating pre-existing kidney conditions, it's clear that careful consumption is crucial. And finally, we touched on the topic of drug interactions. Baking soda can alter the effectiveness of various medications, including antibiotics and diuretics, which could have serious health consequences. In summary, while baking soda has its benefits and is a useful tool in both cooking and health, it's crucial to use it in moderation and with knowledge. always consult with a healthcare professional before incorporating it regularly into your diet or as a treatment for any condition. Take care of your health and stay informed. Thank you for joining us on this exploration. If you enjoyed the video, don't forget to like, subscribe to our channel and hit the bell icon to stay updated on our upcoming videos full of useful and fascinating information. Until next time.